Let me introduce myself first. I am Dr. Sunder Goyal. I am working as a professor and head of surgery in ESI Government Medical College, Faridabad, near Delhi, NCR, Delhi. Okay. I am grateful to Professor Ajan, Dr. Ajan, for giving me a chance to speak in this August gathering of the all expert. My topic is nutraceuticals roles in ED and what is the mechanism of PDE inhibitors, how they work. I'm grateful to Dr. Rajshekhan and Dr. Vasan. They have already partially touched nutraceuticals in their lectures. And I add one thing, neutraceuticals were used right and left before the era of sildenafil or PDE inhibitors. So many speakers before me, they have discussed actually the mechanism of action of the PDE inhibitors. So two things I want to, previous slide please. Previous slide.
Next. Sorry, sir.
Okay. So here, this is a nitric oxide which enters in the cells and takes these cycles, and main is the cycling GMP, which is important for dilatation and erection. So PDE5, they disintegrate it and they bind it with them so that it decreases and changes to 5-GMP and there is no erection. But if we give PDE5 inhibitors, they act at this place and the cyclic GMP is increased in amount, then they go as a protein. These protein, they lower the calcium in the cells that cause relaxation of the vascular smooth muscles and lead to erection. So this is very important actually. PDE5 inhibitors don't increase the nitric oxide level, but they potentiate the effect of nitrogen. So without sexual arousal, there will be no release of nitric oxide. So PDE inhibitor will be of no use. So sexual arousal and release of nitric oxide is very important for PDE5 inhibitor to work. So there are several feedback mechanisms which decrease the PDE cyclic GMP actually. So there is a key degradation at catalytic site and there is a fixation of CMP and non-catalytic site, so its amount decreases, so there is no erection because finally increased binding of GMP at the allogous site similar to this degradation catalyst site and the further phosphorylation of this enzyme, which ultimately leads decrease of 6-GMP. So this is a slide which I made actually. It will give you the whole mechanism of action. There is a sexual arousal for nitric oxide that enters in the cell and gives to GTP and guanylyl cyclase, and there is a production of cyclic GMP. So this cyclic GMP, they are the PDE5 in the cells, they act to decrease it actually. How they decrease? They cause degradation of at catalyst site and there is a binding of CMP to non-catalytic site, they are called allostatic sites of PDE5 inhibitor. So this is the site where the PDE5 inhibitor works actually. So they block it, they bind with them, and there is a high amount of cyclic GMP in the cells, which result in protein kinase G. They act there further to decrease the calcium, and this causes smooth muscle relaxation and ultimately erection of the penis. So in conclusion, does phosphorylated PDE5 affect the binding of PDE5 inhibitor such as vardenafil and tadalafil? Phosphorylated PDE5 increases its enzymatic activity as well as affinity for its allostatic site. It means PDE5, they make cyclic GMP to bind actually at the non-catalytic site and as well as they degrade it by the enzymatic activity. So does inhibitor bind to the PDE5? molecule to increase when PDE5 is phosphorylized? Does inhibitor bind to PDE5 molecule and increases when GMP bind to its cellular site? Is the clearance of PDE5 inhibitor from smooth muscle cell delayed by tightening or binding of this inhibitor to the cell? So this is in conclusion actually how it functions. All drugs, sildenafil, tadalafil, and vardenafil, they have got a half-life. That means it is a clearance from the plasma. But something it is interesting in few men, that in spite of the plasma clearance of the inhibitors, which falls below the therapeutic level, still they have a erection. How that happens actually? So, is there a persistence of biomedical effect after the inhibitor is cleaned from the cells? Or there is a tensional drug in the smooth muscle behind the plasma clearance? So these 2 points one has to ponder over actually, whether it is a persistent biochemical effect or whether it is a tensional drug in the cell itself. So they keep on having dilatation of the muscles and there is a persistent erection in spite of the fall of the plasma level of the inhibitors. What is the molecular mechanism that could account for the prolonged action of the PDE5 inhibitors? So this is a very important thing. Usually all PDE5 inhibitors, they work till the drug is in the serum. Once they are cleared of the effect falls actually. But in few people, there is a sustained action of this in spite of clearance from the plasma. So what are the various possibilities for that? That may be binding with a high affinity to the intracellular receptor such as PDE5. If PDE5 are more, inhibitor will go more and they will bind with the PDE5 receptors and they will keep on staying even after their clearance from the plasma. Second thing, PDE5 inhibitor would have reached to higher concentration in the cell where PDE5 is particularly abundant. So it is one and the same thing, directly or indirectly. It means the inhibitor goes to the cells in few patients or people who have got high receptors of PDE5 and they bind with them and they keep on staying there in spite of the plasma clearance. So there you can say there is a memory device also. Few cells they have got a memory that they are sticking with the PDE5 inhibitors and there is a blockage of the calcium and there is dilatation of muscles and smooth muscles in the penis, corporas, and there is a retained, sustained erection in spite of the clearance of the PDE5 inhibitors from plasma. This is an interesting phenomena we have to ponder over and need research subsequently. So this again the repetition of the file, how the prolonged action of the PDE5 inhibitor does actually. There is a prolonged phosphorylation, there may be some structural changes, there may increase sensitivity to cyclic GMP, there may alter protein level, or there may be some translocation due to memory of the cell. So all these factors, they lead to prolonged effect on the penile action even after PDE5 inhibitors level has gone down in the serum. Even they are very low at the cellular level. Same thing. So there may be prolonged effect in spite of the clearance from the plasma. So the CMP may be more than the basal level or PDE5 are still inhibited or blocked by the clobet inhibitors by sticking with them, by binding with them. These both link to prolonged effect of PDE5 inhibitor on penile erection. So there are points to ponder actually. No doubt we know PDE5 inhibitor is the drug of choice in erectile dysfunction. Agreed. They are the wonderful drugs. Fine. But there are few points which I have gathered. How to increase the level of nitrox in the body? Does the organic nitroxide supplement works for this, or it is a psychosexual sensation of the man only, brain only, that stimulate the neurotransmitters, and there is a production of nitric oxide. But by taking oral natural supplement, we can increase the level in the body. Number one, like this, by addition of L-arginine or these can potentiate the effect of PDE inhibitors. Then how to increase the binding of PDE inhibitor to PDF5 catalyst sites so that they can retain even after the plasma clearance, and there can be a prolonged effect on the erectile dysfunction leading to persistent and residual erection. But if we go in the study, vardenafil has been better affinity for PDF5 than tadalafil and sildenafil because it has got a heterocyclic double ring. So, if we give vardenafil, there are chances of persistent erection even in spite of clearance of vardenafil.
முடியாதுன்னு வந்து என்னோட இது பிரசன்டேஷன் இன்னும் பெண்டிங் இருக்குன்னு ஒருத்தர் போட்டுக்கிறாரு. எப்படி?
How to decrease the GMP degradation at a catalyst site? This is another point of wonder. Usually GMP is responsible for all dilatation and erection.
நான் போட்டேன் போஸ்ட்.
So how to
mute it?
Sorry sir.
How to decrease the binding of the CMP to PDF aerocyte sites, and how to prolong the exposure of the protein to PDF inhibitor or the other process, and how to lower the phosphorylation of PDF5. Because if we lower the phosphorylation of PDF5, there are chances of erection, greater erection, and a duration will be prolonged. So these points we have to ponder and need the research work. And this is another female sexual arousal disorder where the PDF5 is exposed in clinical clitoris, corpora spongiosum, and in vaginal smooth muscle and epithelium. Increased level of cyclic GMP has been shown to occur in human culture vaginal smooth muscles treated with the PDF5 inhibitor, suggesting involvement of the nitric oxide or cyclic GMP axis in the female sexual response. There is a possibility that PDF5 inhibitor could affect female sexual arousal disorder, but further research is needed for that. Thank you.